Patellofemoral pain syndrome is a really common knee condition that describes pain generally around or right behind the kneecap. The pain typically increases with prolonged flexion or loaded flexion of the knee. So prolonged periods of sitting or squatting where you're loading that knee into flexion, going downstairs, things like that. So today I'm going to show you the three beginning exercises that can be helpful for patellofemoral pain syndrome. In general, the guidelines for rehabbing patellofemoral pain syndrome strongly recommend focusing on strengthening the quads or the thighs and the glutes in a pain-free manner. So this would be a starting point, and these are three easier exercises you could start with when dealing with this condition. And the first one I'm going to show you is going to target the quad, the thigh muscle in the front of the hip. And you're going to lay on your back. You're going to have the unaffected knee bent and the leg with the knee pain out straight. From here, you're going to tighten that thigh muscle, engaging the thigh, straightening the knee. It'll kind of pull your kneecap up. And keeping that engagement, you're going to lift 30 to 45 degrees and lower. This is called a straight leg raise, and it usually is a way to start working that thigh in the front of the hip that doesn't cause knee pain. So going 10 or 20 of these until you feel that thigh fatigue, but we don't want the knee pain. The second exercise I'm going to show you is going to work the glutes. Specifically, we're going to target the glute med or the side butt area. So this is sideline hip abduction. You're going to lay on your side. You're going to tip that top hip forward, straighten the leg out, straighten the top leg out, and then reaching that top leg out and back at a 45-degree angle. You can kind of reach it for the wall behind you. And you want to feel this one right where your back pocket would be, right in that glute med muscle. So again, we want to do both sides, or especially the side with the knee pain. No pain in the knee here, but getting good fatigue from that glute muscle. The third exercise I'm going to show you is the most challenging, but it's usually well tolerated when there's knee pain, and it's easy to modify. You're going to come up against a wall or a door, and you're going to lean your back into that wall, letting your weight lean into the wall, walking your feet forward about a foot, knees hip width distance apart, and then you're going to let your back slide down the wall to a point where you do not have knee pain. You don't have to be all the way down to that 90-degree angle. You can be a little bit higher. And you're going to start by hanging here for 20 to 30 seconds until you feel a good burn in the thighs without feeling the knee pain. So the common theme is that we want to feel the muscle work without feeling the pain. And we're going to start with those three exercises. If any of them do give you pain, you're going to want to find a different exercise to swap out at the beginning. If those three feel good and you can get your muscles working without pain, go ahead and do 3 sets of 10 to 15 with the ones on the floor, or 2 fatigue, and shooting for about 20 to 30 seconds when you start out with the wall sits.